Hello friends, welcome to our show. A lot of people are suffering from various health problems and one of them is varicose vein. Let me introduce to you Dr. Pradeep Mule, Senior Consultant Interventional Radiologist practicing in New Delhi, India. Welcome to the show, Dr. Mule. Okay, but what are the causes? Talking about the causes, is prolonged working or prolonged standing on legs, or what are the basic causes for such varicose?
The basic causes is the prolonged, long standing hours.
The blood flow gets accumulated in the veins.
And that wall may sometimes get damaged also.
Okay.
But when you see in a woman, right, after the pregnancy, this happen very commonly.
Yes.
Right? Because there's so much pressure is there in the abdomen. So because of the back pressure, the one or two wall they may get damaged also. So during the first pregnancy, they may not having any problem. But when they conceive another pregnancy comes, that time this condition become more worse. Because in the second pregnancy, this wall get further more and more damaged.
Dilated.
So that's right. And even the obesity also is the big problem nowadays in society. So those are the obese. They may develop the varicose veins also.
Okay, so talking about the lifestyle, how does this varicose vein affect the lifestyle?
Once I wanted to tell that how the lifestyle that gives the varicose vein to you.
Okay.
Nowadays we are seeing particularly in the young women, right? Those are wearing the high heel sandals. That
yes.
also can cause.
Generally, girls wear.
Even sometimes I've seen that low-lying tight jeans.
Yes.
Right, because the low-lying tight jeans which comes into your pelvis, right? So that compresses the superficial vein.
Okay.
And that gives the engorgement and dilatation into the leg vein also. So even I don't say that you don't do this kind of things or a tight jeans or a high heel sandals, but you should know that this can happen by that. So you should take some little precautions and other things.
You should
also
take care about it. Avoid wearing tight jeans and high heels for a long period.
For a long period.
Okay, but who are the people who are very prone to get varicose vein?
Those having the standing jobs.
Okay.
Obesity. Pregnancy, you cannot avoid that.
Okay, yes.
But you have to take some precautions to avoid the varicose vein, right?
Okay, you said about the one condition when the veins get swelled up. But what about the next step? What happens when these varicose veins get worsen in condition?
See, the beginning of the symptoms is just the pain and the discomfort and some heaviness. But later on, when you not treated this one, right? So furthermore, what can get the person, right? May get some color changes, pigmentation. May sometimes they develop the venous ulcer also.
Okay.
Venous ulcer is not healing ulcer because the venous pressure is so much, and the venous pressure on the venous blood, the less amount of the oxygen is there. So that's why it's difficult to heal also. That may continue this venous ulcer for 1 month, 2 months, 3 months. Sometimes I see the very small size to the bigger size of the venous ulcer.
Growing gradually.
It is growing gradually, yes.
Okay, so what are the other non-surgical treatments you offer?
Other non-surgical treatment is the long list, right? Being intervention, vascular intervention radiologists all over the world, when you see that there's so many number of the diseases are there. So today just I wanted to tell you about what the common type of the non-surgical treatment normally that general public also knows about that. Like a uterine fibroid, adenomyosis, pelvic congestion syndrome, blocked fallopian tube, and varicose veins, what we talked about that right now, and back pain because of the disc herniation. In this we do the ozone therapy and nerve blocks kind of things, and even the untreated liver tumors.
Okay.
That also can be done by the similar kind of the technique, right? The radio frequency ablation. And in man, the large prostate and the varicocele. Varicocele is the condition, that the tangled vessels comes in this program that normally happen to the younger age. So people, they don't like to go for a surgery, right? So the embolization technique is one of the best technique for them today.
Okay, so there is a wide number of non-surgical treatments you are offering. That's very good. And thanks for sharing your information on this varicose vein. I hope this will impart knowledge to people who are suffering from leg pain, and they'll diagnose that either they are suffering from varicose vein or not, and get a non-surgical treatment for sure. Thank you for coming, Dr. Mule.
Thank you.